I'd like to share a hip mobilization that's commonly forgotten, and that's bilateral medial groin or medial iliofemoral joint mobilization. Now, the reason why I have the pelvic model here is for us to appreciate this is a circular osseous closed ring. So anytime we go into, say, a squat, which is a fundamental pattern of movement, and we exhibit an asymmetry, we do run the risk of experiencing abnormal stress. So if you're that person that has a leg length discrepancy, a known asymmetry in the structure right to left, you have to take this mobilization very, very lightly at first. In other words, don't be too aggressive with it. Listen to your body. It is also an assessment to understand your threshold. So as I squat into a deep position, I want to have freedom at the iliofemoral joints. So that's just a fancy word for space. A hip is nothing more than a space built for motion. So it should make sense to us that we have symmetry right to left. So as I drop down into the squat position, I should have the ability to go all the way down, and in fact feel very comfortable here. We used to have this ability, but then as we start with kindergarten, first and second and third grade, we start sitting more, so therefore our biology simply adapts to the cultural environment. So we lose the ability. Even this elastic recoiling, believe it or not, is very healthy. It creates an articular pump. The fluids move in and out. It's very healthy. It shouldn't be a stress and strain. But once again, many people have difficulty with this. So this mobilization will help you. I go up against a wall, and I get into the same position. I'm just horizontally more displaced relative to the floor. So I can get in this position in what we call abduction, so my knees are apart, to a comfortable position where I do feel stress within this region, in the inner region of the thigh. If you feel pinching on the outside, this is not a position for you. I would not recommend it. That means there's too much compression. What you should feel is a lot of tension in the groin. Use your body weight as the driver. You'll notice I go just nice and slow, nice and easy. Another great way of helping you to gain motion is to contract bilaterally both knees into the ground. It's very, very subtle. So I'm creating what's called an isometric contraction, both right and left. I squeeze for about 4 to 6 seconds, and then I just relax. Sink deeper into it if I can. Squeeze the floor. 1, 2, 3, all the way to 6. Then I relax and go deeper. Now once I get into this comfortable position, although I feel the stress, healthy stress, what I'm going to do is create a rotation. You go nice and slow, and what you search for is any kind of stickiness that may exist. Now, from a manual therapist perspective, we call that densification. When the tissue becomes fibrotic, it gets dense. And that presents a lot of problems when we're out freely moving. So in this case, I can isolate in, we call it local mobilization, to try to find the area that's sticky. And I'll work that and spend some time doing so. I can go back into what's called elastic recoiling. This should not be confused with ballistic abrupt movement. Elastic recoiling utilizes the energy and transfers it efficiently. When you feel strong, that's what you're actually exhibiting, is a good elastic recoil within your connective tissue matrix. And I can also progress this, where I can spin around and go a little bit more lateral. Spin around, a little bit more lateral. Okay, and then I can slowly come out of that. Try to really get my chest up like that, if it feels comfortable. My final comment is we must appreciate what's happening a lot in today's society are these labral tears. A labrum is a circular fibrocartilaginous structure. And those are some fancy words for, it's a helical structure that when we move, movement is rotation, it actually creates a suction stability for the hip. You cannot have a disruption of unity, which is the definition of an injury, without stress. When the stress concentrates much greater than your ability to adapt, you get breakage. So, one of the reasons why I'm sharing this with you is if you're having difficulty with it, learn to obey it. Don't just work through it. And each time you stress this area, try to work on figuring out where you need to concentrate the most so that eventually you can get into deeper ranges so that when you're out and about in the everyday life and you go down to get something, it's very easy to do. In other words, that elastic recline. And just if you're wondering, I was the type of person at 29 and 30 years of age that could not squat all the way down because I did adapt to a chair. This took me roughly 8 to 12 months to have no problem going like this with ease. So it does work if you put the time and effort into it, but it does take time. I hope you enjoyed this little clip, and we'll see you soon for another segment.